A very good morning to all of you. So this is our third part of the question important for the grad Viva. Already two parts I have shared. So you just watch that video. Okay. So now up to most of the topics already covered. Now start from your nucleic acid chemistry. Okay. So let's start today's session. In nucleic acid chemistry, first thing you should know what is nucleoside, what is nucleotide. What is difference between nucleoside and nucleotide? Okay. Second thing is important thing is you should know the difference between DNA and RNA. What are the different types of RNA that you should know? Which is the most abundant RNA? Okay. Which is the most massive RNA? Which is the smallest RNA? All these important for your Viva. What is Watson-Crick model of DNA? Okay, this. Okay, now next important thing that you should know the synthesis of purine and pyrimidine. So you should know what is purine, what comes under purine, what comes under pyrimidine. Okay, so in purine, nobody will ask the de novo synthesis of neither purine nor pyrimidine for the Viva. You can skip that. But what thing you must read in your Viva? That is, you should know the salvage pathway. Okay, what is salvage pathway? Next important question is that why brain and RBC are totally dependent on the salvage pathway, and why de novo synthesis is not possible in brain and RBC. What is the reason behind that? You should know the reason. Okay. Next important disorder is that of Lesch-Nyhan syndrome. Very important. In Lesch-Nyhan syndrome, the important thing is that of what is Lesch-Nyhan syndrome? Which enzyme is deficient in Lesch-Nyhan syndrome? What is the inheritance pattern of Lesch-Nyhan syndrome? And what are the clinical features of Lesch-Nyhan syndrome? Important, what are the biochemical basis of hyperuricemia and gout in Lesch-Nyhan syndrome? Okay. While in the disorder of Lesch-Nyhan syndrome, while hyperuricemia or gout is present, what is the reason behind that? Why the patient present with the self-mutilating behavior? Why there is a urgency to biting of this thing, nails and upper lip? Why the patient? Why? What is the reason behind this self-mutilating behavior? What is the reason behind the mental retardation or neurological manifestation occurring in patient of Lesch-Nyhan syndrome? You should know the reason and biochemical basis of all the clinical features occurring in patient of your Lesch-Nyhan syndrome. Important for your grand Viva. Okay, now comes purine degradation. Purine degradation important is gout. Very, very important topic for grand Viva, gout. What is gout? Which joint is first affected in patient of gout? What are the risk factor of gout? What are the causes of primary gout? What are the causes of secondary gout? How you will manage the patient of gout? And what is the mechanism of action of allopurinol? And why the allopurinol inhibition is called suicidal? Why it is known as suicidal inhibition? You should know the reason of this suicidal inhibition. Okay. And what is one important thing? Sometimes examiner asks that what is difference between gout and pseudo gout? That also you should know. What is the reason difference between gout and pseudo gout? Next important thing is why alcohol precipitate the attack of gout. Okay, so these are the important question of gout in your grand Viva. Okay, now comes on the pyrimidine synthesis. Pyrimidine synthesis as such not important whole for the UG student. The thing you should know is that of orotic aciduria. You should know what is orotic aciduria and which enzyme is deficient in patient of your orotic aciduria. Okay, this is all about your nucleotide chemistry. Now comes on your hemoglobin. Hemoglobin and its chemistry and its metabolism. In hemoglobin, its first thing you should know what is the subunit of your HbA, HbA2 and HbF, and what is the percentage which occur normally in your blood. That how much percentage of HbA occur, how much percentage of HbA2 occur, and how much percentage of your HbF occur in the normally in your blood. That you should know. Next important, hemoglobinopathy. You should know what is hemoglobinopathy. Okay. In hemoglobinopathy, you should know the sickle cell anemia. What is sickle cell anemia? What are the molecular bases of sickle cell anemia? Which amino acid replaced in which chain of hemoglobin? What is the mechanism of sickling during deoxygenated state? You should know the mechanism of sickling in deoxygenated state. How you will diagnose the patient of sickle cell anemia? What is sickling test? Okay, and how you will treat or manage the patient of sickle cell anemia. Okay, all these are important questions for Grand Viva in sickle cell anemia. Now comes on your thalassemia. Why the word, from where this term thalassemia comes? What is meaning of thalassa? That you should know. How many types of thalassemia? The alpha and beta. So you should know the types of alpha thalassemia. You should know the types of your beta thalassemia. What are the molecular bases of this alpha thalassemia and beta thalassemia? Okay. And this is all about your thalassemia. Another important thing is that of you should know methemoglobinemia. What is methemoglobinemia and in which state of iron will occur in methemoglobinemia? That you should know. Now comes on the heme synthesis. So how heme is synthesized in the body? What are the initial step of the heme synthesis? Excuse me. Okay. So what are the initial step of synthesis of your heme synthesis? What is the rate limiting enzyme of your heme synthesis? Okay. Next important, lead. Lead inhibit which two enzymes of your heme synthesis? And why if patient of having a lead poisoning then suffer from the anemia, what is the reason behind that? You should know. Okay. Okay, first thing to lead, what important thing you should know, that is lead inhibit which two enzymes of your heme synthesis? While in patient having a lead poisoning, then what kind of anemia will occur and why the anemia will occur in the lead poisoning? You should know the reason. Next important thing is that of porphyria. What is porphyria? You should know the name of all porphyria and what are the enzyme deficient in each porphyria. Okay, and which is the most common type of porphyria? In which porphyria there is a neuropsychiatric symptom will be there? In which porphyria there is a cutaneous symptom is there? In which porphyria both neuropsychiatric as well as cutaneous symptom will be there? That you should know. How you will treat the patient of your porphyria? What is the treatment strategy of your porphyria? Okay. Now comes on your heme catabolism. Heme catabolism, all steps you should know how heme is catabolized in the body and how ultimately bilirubin will form. What is conjugation reaction in bilirubin synthesis? Okay, and which enzyme is required for the conjugation reaction? That you should know. Important thing is that you should know what is jaundice. You should know the proper definition of jaundice. Okay, how you will define jaundice, so you should know proper definition of jaundice. Second important thing, difference how you will clinically diagnose or on the basis of your lab diagnosis you will differentiate prehepatic, hepatic and posthepatic jaundice. And what are the causes of prehepatic, hepatic and posthepatic jaundice? Important. You should know the name of all four disorders name of your congenital hyperbilirubinemia. You should know names. Okay, Crickler-Nazar, Dubin-Johnson, Bruton, okay, and your Gilbert. So you should know the at least name. Really, at least you should know the name of this congenital hyperbilirubinemia. Okay, so this is about your hemoglobin. Now comes on another topic is that of your vitamins. Very, very important vitamins. Vitamins are very most important and must read topics for your Grand Viva. Okay. So first, I think I will tell you what you must know for vitamins. First thing in Grand Viva, you should know what are the recommended daily allowance. That is, what is the RDA of all vitamins. The first thing you should know the RDA of all vitamins. You should know the dietary sources of all vitamins and what are the deficiency manifestation. Okay, so RDA, dietary sources and deficiency manifestation of all vitamins you should know. For B complex, you should know the name of all B complex along with their coenzymes. Alright, so this is the basic that you should know. Besides that, you should know the biochemical functions of all vitamins. So in all vitamins is a must read, and for Viva you must read all the vitamins. Okay, it's not a theory that you can skip. Okay, so you for Grand Viva you must read all the vitamins. You should know RDA, you should know the dietary sources, you should know biochemical functions of all vitamins and your deficiency manifestation. Okay, so now comes on the vitamin A. Vitamin A, we should know what are the vitamins of vitamin. What is the function of retinol and retinoic acid? Okay. What are the biochemical, as I told you, RDA dietary sources, biochemical function, you should know. What is word visual cycle? Excuse me. Okay. You should know what is word visual cycle. Next comes on your vitamin D. Vitamin D, important is that how vitamin D is RDA, dietary sources, you should know. Biochemical function, you should know. Vitamin D, important thing is how vitamin D is synthesized in the body. And what is the vitamin D2 and what is vitamin D3. You should know what is vitamin D2 and what is vitamin D3. Next important thing is why calcitriol is known as triol. That at what position that 3 OH group are attached in calcitriol. That you should know. Next important is that question, why vitamin D is considered as a hormone. What is the reason behind that? Okay. Next important, what are the 3 target organs of vitamin D? And how vitamin D regulates the calcium and your phosphorus metabolism. Okay. And what are the deficiency manifestation? As you know, rickets and osteomalacia. So in rickets, you should know the clinical feature from top to bottom. That is from head to toe, what we will get in the children if suffering from rickets. Okay, starting from the head and what you will then going to the toe, you should know all the clinical feature of your rickets. Okay. Now comes on vitamin E. Vitamin E, dietary sources, RDA, biochemical function, you should know. And vitamin E, important thing is how the vitamin E maintain the RBC integrity. Okay, that how vitamin E maintain RBC integrity. And if there is a deficiency of vitamin E, then there is a hemolytic anemia. Then why? What is the reason behind that of how vitamin D prevent the hemolysis of the RBC? So you should know the reason. Next question you should know the name of all antioxidant vitamin. Okay, what are the name of your antioxidant vitamin? So antioxidant vitamin is your that of ACEAs. Vitamin A, vitamin C and vitamin E. All 3 vitamins are your antioxidant vitamin. So you should know the name of your antioxidant vitamin. Now comes on your vitamin K. You should know all 3 forms of K. K1, K2, K3. Okay. What is the biochemical function of vitamin K? An important thing, for which clotting factors the vitamin K will do this your post-translational modification. So you should know the name of clotting factors. That is your 2, 7, 9, 10. Okay. So you should know the name of these clotting factors. For which clotting factors this vitamin K is required for post-translational modification. Okay. Next important, what is the deficiency manifestation of vitamin K? And what is the reason why newborn are more prone for hemorrhagic manifestations? Why? You should know the reason. Okay. Next important thing is examiner can ask as the newer immunization schedule nowadays. In newer immunization schedule, now vitamin K is given prophylactically also. So what is the dose and what is the route of administration of prophylactic administration of vitamin K? That you have to know. Okay. Next comes on your vitamin C. Vitamin C is that of important thing, RDA, dietary sources, biochemical function. Which manifestation occurred by the deficiency of vitamin C? So your scurvy will be there. Scurvy, important question is asked, why gum bleeding is occur in patient of scurvy? What is the reason behind that? Next important, what is the role of vitamin C in collagen? That you should know. What is the role of vitamin C in collagen synthesis? Next important thing is that what anemia will occur in patient of suffering from vitamin C deficiency and why there is anemia will occur in patient of vitamin C deficiency. All these questions regarding your vitamin C. Now comes your B complex. In B complex, first is B1, that is of thiamine. Thiamine, you should know what are the, as I told you before, B complex, all you should know the name of all B complexes along with their coenzymes. What are the coenzymes forms of your all B complexes? Okay. Now, important in thiamine is that of beriberi. So, you should know the difference between dry, wet beriberi and infantile beriberi. Or you will differentiate all three beriberi. Next important, what is Wernicke-Korsakoff syndrome? Out of this Wernicke-Korsakoff syndrome, what clinical feature occur in Wernicke? What clinical feature occur in Korsakoff syndrome? Out of this, which is acute condition, which is chronic condition? On Wernicke's, already I shared a mnemonic. You can go through that. Here, there, I will just cover all these things regarding which is asked frequently in the Viva for Wernicke's. Okay, so you Wernicke's in Korsakoff syndrome, you must read. Now comes on your B2. So B2, you should know the biochemical function. Okay, and deficiency manifestation. Next important is vitamin B3, niacin. So niacin, first thing is that you should know niacin is formed. Niacin is synthesized inside the body from which amino acid? So it's a tryptophan. An important thing is that how many milligram of tryptophan is required for synthesis of 1 milligram of niacin? Answer is that of 60 milligram. Okay, so 60 milligram of tryptophan is required for the synthesis of 1 milligram of niacin. Important question. Next important niacin, what are the, as I told you, RDA and dietary sources you have to know. Okay. Next important thing is that of what are the deficiency manifestation. So pellagra is there. So what are the clinical features or what are the 4 Ds? Initially there was 3, but now it's a 4 Ds. So what are the 4 Ds of your pellagra? Next important thing is that if a patient is on anti-tubercular treatment and we prescribe isoniazid as ATT, then along with isoniazid, why we are supplement vitamin B3 to the patient? What is the reason behind that? Along with isoniazid, while we prescribe vitamin B3 along with isoniazid, so you should know the reason. While the patient of heart nerve disease and carcinoid syndrome present with the pellagra-like symptom. What is the reason? Next important is that if patients, if any person has staple food of jowar and maize, then why they are more prone for development of pellagra? Okay, what is biochemical basis behind that? Okay, so that all these questions for your niacin. Next come another vitamin, that is B6, that is of your pyridoxine. So you should know what is the coenzyme form. So PLP is the coenzyme form, and biochemical function of PLP you must know. Very important, biochemical function of your PLP you should know. Okay. Next important thing you should know is that of why peripheral neuropathy. Question can be asked, why peripheral neuropathy occur in patients suffering from deficiency of this pyridoxine? What is the reason behind that? So you should. Next comes on another vitamin, that is B7, that is of your biotin. So B7, what is the another name of vitamin B7? Okay, so you should know it is also known as vitamin H and biotin. So you should know another name. Next important biotin, what is the biochemical function of this biotin? So it helps in the carboxylation reaction. Next important is what is the why biotin is known as anti-egg white injury factor? Why? So you should know the answer. Next important then, what is the antidote and what is the role of avidin? So you should know avidin. Okay, role of avidin related to your biotin. Next important, very important question for Viva is biotin independent carboxylation reaction. Very important question. Although biotin helps in the carboxylation reaction, but there are some exceptions. Okay, some exception reaction in which biotin don't play a role. So you should know the reactions which are biotin independent carboxylation reaction. Very important question for you. Viva related to your biotin. Now comes on your B9, that is the folic acid. Important thing, folic acid is that of what is 1-carbon metabolism? You should know brief about 1-carbon metabolism. What are a deficiency manifestation occur in the patients of folic acid? So it's a megaloblastic anemia. Okay, megaloblastic anemia. And next important thing is that if why we have prescribed the folic acid to a pregnant female, and why we prescribed folic acid 5 milligram BD prescribed to the patient before conception, and how this vitamin B9 prevent the neural tube defect. You should know the reason. What is the reason? How this B9 prevent neural tube defect. Next important thing, you should know the name of all neural tube defect. So you should know what is the role of prevention of neural tube defect by B9, and you should know the name of all neural tube defect. Okay, B9. Next important vitamins is that of your B12. B12 important thing is biochemical function. So there are two reactions inside the body which are B12 dependent. So you should know both these two reactions. Next important thing is that of what are the deficiency manifestation of your B12. The B12 deficiency also called megaloblastic anemia. So important question for the Viva: if a patient comes with megaloblastic anemia, then how you will differentiate that whether patient is suffering from B9 deficiency or patient is suffering from B12 deficiency. So how you will differentiate whether megaloblastic anemia is due to B9 deficiency or B12 deficiency. So you should know the difference how you will diagnose. Okay. Next important thing is that of folate trap. Very important. What is folate trap? Okay. Already I shared a short video on folate trap. So you just go through that. Okay. Folate trap very important and related to your Viva. So this is all about your vitamins for your Viva. Now comes on your minerals. So minerals, the thing you should know, what are the major elements, what are trace elements, and why major is called major and why trace are called trace. You should know. Next comes on your calcium. Important, you should know the dietary sources of calcium. What are the RDA? Okay. So dietary sources and RDA, and what are the functions of calcium inside the body. Next important, how calcium metabolism is or how calcium homeostasis is regulated. So you should know briefly, for the Viva you should know brief how the calcium homeostasis is regulated. Next, being a doctor, if you are posted in a casualty and a patient of tetany will come, then how you will manage that patient, because tetany is a medical emergency. So how you will manage the patient of tetany. You should know what is carpopedal spasm. You should know what is Chauvistic sign, what is Taussig sign. Okay, so these are the important in your calcium. Okay, now important is that of your that of iron. Very important. Iron, important thing you should know what is the total body content of iron. The value should know what is total body content of iron. Next, what are the dietary sources of iron. Important thing is that except of hemoglobin, what other proteins in which iron is present. So you should know the name of other protein. Another thing is that you should know the RDA. What is the RDA of iron? Next important thing is that how iron is absorbed. Very important, iron absorption. How iron is absorbed and what is mucosal block theory. Very important. Okay. So how iron is absorbed, in which form iron is absorbed, and what is mucosal block theory. What is the role of vitamin C in iron absorption, that is how vitamin C help in iron absorption, and what is the role of ceruloplasmin in iron absorption. You should know for Viva. Another thing is you should know iron deficiency anemia. What are the causes of iron deficiency anemia? Okay, what are the different causes of your iron deficiency anemia? Next, how you will diagnose. For iron deficiency anemia, you should know the causes. You should know the excuse me. I should know the lab diagnosis, and you should know the causes of your iron deficiency anemia. Next important question is that of difference between hemosiderosis and hemochromatosis. Okay, examiners sometimes ask how will you differentiate hemosiderosis and how you will differentiate chromatosis. The first thing you should know what is hemosiderosis, and then first you should know what is hemochromatosis and what is difference between hemosiderosis and hemochromatosis. This is all about in iron. Next important question is ectodermatitis enteropathica disorder will occur in which mineral deficiency? Okay, we should know answer is zinc. And zinc deficiency is there, then patient suffering from ectodermatitis enteropathy. That's all for the day. Now comes on the copper. What are the enzymes in which copper act as a cofactor? Okay, you should know at least 3 to 4 enzymes name you should know in which copper act as a cofactor. Next comes on copper is that of Wilson and Menkes. Okay, which gene is mutated in Wilson disease? Which gene is mutated in Menkes disease? Okay, Wilson, very important for Viva. What is the another name of Wilson disease? What is KF ring? Fisher ring. Okay, and how patient present with KF ring? You should know. How you will diagnose the patient of Wilson? If patient is suffering from Wilson disease, how you will diagnose the patient of Wilson disease? And what treatment you will give the Wilson patient. Okay, these are the important questions related to your Wilson. Okay, next iodine and fluorine chemistry. It's not very important for the Viva. Next, another important topic comes on the nutrition. Important thing you should know, what is protein energy malnutrition and how you will differentiate the patient of Kwashiorkor and marasmus. So you should know the differentiating feature of Kwashiorkor and marasmus. And why the edema will occur in patient of Kwashiorkor. What are the biochemical basis of occurrence of edema in patient of Kwashiorkor? You should know biochemical basis. Okay. Next important, what is BMR? What is basal metabolic rate and what are the factors affecting BMR? That's it. Definition of BMR, and you should know only the name of factors affecting BMR. That's it. What is specific dynamic action? You should know the definition of SDA. That's it. Okay. Next comes on the nitrogen balance. We should know what is nitrogen balance, what is positive nitrogen balance, what is negative nitrogen balance. Okay. And next, another important thing is that of obesity. Obesity sometimes asked. Okay. So obesity, what is obesity and what are the risk factor of obesity? Okay. And how you will manage the patient of obese. If patient is comes in your OPD and he is obese, so what management you will do? Obesity, you just read it in a. Okay. So next, this is all about your nutrition. Next comes on your function test. In function test, important is that of kidney function test. Kidney function test, what things you must know about Grand Viva? What is clearance test? You should know the definition of clearance test. What is the difference between inulin, creatinine and your urea clearance? What are the advantages and disadvantages of all three? Inulin, creatinine and your urea clearance test. In which unit you will express this clearance test? Unit per, you should know what is ml per minute that you know. What is the value of normal GFR that you should know? What is difference between microalbuminuria and macroalbuminuria? Difference. And what are the causes of microalbuminuria and what are the causes of your macroalbuminuria? That you should know. Another important thing is that you should know is that of how creatinine is formed inside the body. Very important question for Viva. Which three amino acid is required for creatinine synthesis inside the body? Very important question for you. Okay. And abnormal urine, as such you are performing in your practical exam. So abnormal urine is important all over for your practical, like this thing, your Viva. And if examiner asks, so examiner can cover it also in the Grand Viva. So abnormal urine as such is very important for your practical. Okay. So here I am not discussing the abnormal urine. For that I will just make a separate video regarding the question of your abnormal urine. So abnormal urine will study in your practical. Okay. Now liver function test. In liver function test you should know what is Vandenberg reaction. Okay. How you will perform the Vandenberg, what is Vandenberg reaction, what is direct test and what is indirect test. Okay. Next important thing, you should know the normal range of total bilirubin, normal range of direct bilirubin and normal range of indirect bilirubin. Okay, you should know the normal ranges of all these three. And when you will say patient is suffering from hyperbilirubinemia, okay, what is the difference between subclinical jaundice and clinical jaundice? Very important question. When you will say patient is suffering from subclinical jaundice and when you will say patient is suffering from your clinical jaundice. Okay. What is the significance of SGOT and SGPT? or AST or ALT, because SGOT is an obsolete term. Nowadays AST and ALT term we are using. Okay, so you should know. Alright, and what is the alkaline phosphatase? What are the different isoenzymes of alkaline phosphatase? What is the significance of alkaline phosphatase? If alkaline phosphatase value is raised, then what diagnosis you will make? And when an important question, alkaline phosphatase in patient of obstructive jaundice. Okay, why ALP level is so much raised? What is the reason behind that? While in obstructive jaundice patient, ALP value is so much raised. What is the reason behind that? That you should know. Okay. So this is all about your function test. Now next important thing is acid-base disorder. Acid-base disorder for grand Viva point of view, first thing you should know Anderson-Hasselbalch equation. So you should know what is the Anderson-Hasselbalch equation. That equation you should. Next important thing you should know what is the different defense mechanism. Okay, how blood pH is regulated and what are the different defense mechanism, which is the first line defense, which is second line defense, which is third line defense. Okay, what are the blood buffers? Out of the blood buffer which act as the extracellular, which is the most important extracellular blood buffer, which of the following act as the most important intracellular blood buffer? So you should know the name. Next important thing, how the kidney regulates the acid-base balance in your body. So you should know at least steps in brief how kidney regulates the acid-base balance. Okay. Now comes on the acid-base disorder. In acid-base disorder, you should know the causes and compensatory mechanism of all: metabolic acidosis, alkalosis, respiratory acidosis, and alkalosis. So what are the causes and what are the compensatory mechanism for that? Okay. What is anion gap? What is significance of anion gap? That you should know. What are the causes of high anion gap metabolic acidosis? Very important question for Viva. Causes of high anion gap metabolic acidosis. Already I shared a mnemonic. You just go through that. The mnemonic for high anion gap metabolic acidosis. Okay. So this is all about your acid-base disorder. So this is all for today. In the next video, we will share the remaining part for the grand Viva. I hope you will like this and you will also like, subscribe and share with your friends. Thank you.